Hello, everybody. Today we're with Sandy. She's been a patient of mine for a couple of years now, and has been responding really well to a technique I do called functional range release. And today she's going to share a bit about how that's helped her.
Yes, Dr. Spencer has helped me so much in the area of two problem areas that I have in my foot and in my arm. And the pain that I would have and nothing. I mean, I've gone to a chiropractor for years, 30 years. I mean, and when he first said, I'd like to try this on you, you're kind of like, well, sure, give it a try. And the pressure that he uses, it's like I don't know, it feels almost like a pressure point you're using on me, and it can be painful to start with because just everything is just so tight, but it's a good feeling. It's a good stretch. It's a good pain if you get my drift there. And we did it first in my foot area, and then he had said he was also taking the course to be working on the upper half of the body. So I was very anxious to get him to get done with that course.
Yep.
And then you started it in my arm. I've had pain in my arm for years, and most of the pain would start here. And then you went on to describe to me that just because a pain can be here, that might not be the origin of where it starts. Mm-hmm. And so you started both up and down on my arm, especially here we started, but then when I explained this pain more to you, you actually went right up into my armpit area, and mm-hmm. the first time you did it, it was like the pain that radiated down my arm right to the end of my fingers was like, wow, that really, really hurts. And now when you do it, it doesn't hurt at all.
Yeah.
Because it just feels so good because it's like a stretch that I could never ever get myself to be able to do, because I do yoga and things like that, which of course promotes a lot of stretching, but the stretch that you give when you do these release point things, it's amazing. It's just, my arm feels so much better.
Yeah.
My foot too. I do wear orthotics in my shoes, but I find that the orthotics even work better because of your procedure. So good. I'm very, very happy with it, and I'm so glad you introduced it to me.
Yeah. Well, thanks for sharing that, Sandy.
You're welcome.